Hello, and thank you for joining us. My name is Dr. Tramika Smith, and I would like to welcome you to today's CDC Partner Update call on COVID-19. This call serves as a way for CDC to share weekly updates on COVID-19 and our latest resources and guidance, especially for the private sector and other partners. Our topic of focus today is on considerations for daily living, but we will also cover more general updates and information from CDC. Our plan is to hear an update from our Chief Medical Officer about what everyone should know about protecting themselves and others. We'll then turn to a subject matter expert who will discuss CDC's new guidance for deciding to go out. Afterwards, our speakers will take questions from the audience. Please note, this call is not intended for media. Media can direct their questions to media@cdc.gov. Again, that's media@cdc.gov. This call will be recorded and later posted on the CDC COVID-19 website, as well as on YouTube. You may remember that over the last couple of weeks, we have discussed changing the day of this call and have shifted the time of this call. Thank you so much to those who participated in our decision point poll last week. I am happy to announce that moving forward, our weekly calls will remain on Mondays at 3 p.m. Eastern Standard Time. If this is your first webinar with us, please see the link on the slide to subscribe to our mailing list to receive future CDC COVID-19 Partner Update webinar invitations. I would like to remind all participants that the CDC website has the latest information, guidance, and communications resources. There are now close to 1,800 documents providing information and guidance for individuals, businesses, and the public on our website. In addition to tools we'll highlight today, some resources posted within the last 2 weeks include testing strategy for coronavirus in high-density critical infrastructure, overview of testing for SARS-CoV-2, considerations for community-based organizations, Animals and Coronavirus Disease 2019, resources for gatherings and community events, considerations for casinos and gaming operations, and considerations for public beaches. Thank you to those who sent questions in advance. We have teed up some of those questions, and I'll also be keeping an eye on the Q&A box, so please feel welcome to submit questions there as well. Note, we will not be viewing the chat box, so please utilize the full functionality of Q&A. I am pleased to be joined today by two CDC experts, Dr. John Brooks, the Chief Medical Officer for the COVID-19 response, and Dr. Emily Ussery, an epidemiologist in the Community Interventions and Critical Populations Task Force. Please take a moment now to review the agenda. For those of you logged into the webinar platform, there will be very few slides used today, so don't be worried if they do not seem to be advancing. Additionally, a transcript will be provided along with this video when it is posted online to YouTube. Now, I'd like to turn to Dr. Brooks for some great updates. Dr. Brooks, over to you.
Well, good afternoon or good morning, depending on where you are in the country or perhaps the world. And Dr. Smith, I really want to thank you for that kind introduction and careful explanation of everything that we're going to go through today. As was mentioned, my name is John Brooks, and I'm the Chief Medical Officer for the COVID-19 response here at CDC. And I'd like to do two things with you today. First, provide a brief update, sort of situational awareness about where we are right now. And then secondly, talk to you all about a couple of scientific developments and guidance that I think you'll find interesting. So how are things going in the United States right now? Well, presently, there are an estimated 2.1 million confirmed diagnoses, and tragically, 118,000 deaths as of the most recent reporting. And while we've seen the total number of diagnoses steadily declining over the last couple of weeks, in the last 7 to 10 days, we've identified an uptick in the other direction. It's beginning to go up again slightly. This is partly due, we think, to the fact that particularly in at least 18 states, the number of new infections is going up. It's not monolithic what happens in the United States. Every epidemic is local, and we're monitoring very closely at the state and county level what the trends are and identifying hotspots as they come along. But we are worried and concerned about this uptick now towards the beginning of the summer, and are going to be paying close attention to that. But a couple of things to say. Interestingly, we learned today that although the total number of hospitalizations across the country has increased, the number of hospitalizations that are due to COVID, as well as the fraction of hospitalizations due to COVID, have been essentially stable. So what we think this represents is good news insofar as it's increasing use of hospital services by people who don't have COVID and are likely going for routine care, and particularly elective surgical care. Nonetheless, we still see focused outbreaks in places where many people congregate. We call this high congregate settings like long-term care facilities, correctional facilities, food processing plants, and other high-risk areas. These, are of particular concern to us because when a outbreak occurs in a food plant or a focused facility in a community, that can then become the source of outbreak moving outside that facility and affecting the rest of the community. We've seen that in some locations. Absolutely, we are not done with this pandemic. I'd like to say that we were, but this is going to be with us for some time, and we all have to continue to do our part to slow the spread and protect each other. And we're very thankful to the American people for their commitment and resiliency thus far. This summer, I know me and probably many of you and many other Americans are looking forward to seeing friends and family, attending events, and doing that as safely as possible. Everything we do has some degree of risk right now, and we've expanded our agency's guidance with tailored tips on ways that people can reduce their risk as they re-engage in personal and social activities. And these suggestions will be further explored by Dr. Ussery on today's call in a moment. I just want to remind folks that in the coming weeks, it's possible that we may continue to see increases in COVID-19. And as I mentioned, we're working closely to monitor this situation. There are, at all times, things that are under your control that you can do to reduce your risk of either acquiring the infection or inadvertently giving it to someone else. Top on that list is washing your hands often. And if you can't use soap and water, then using hand sanitizer is a next second best. Avoiding close contact, so maintaining social distance of at least 6 feet between people. And when you can't maintain that distance for some reason, using a fabric face cloth or face covering to reduce the likelihood that you may expel unknowingly virus you could be carrying and give it to someone else. Of course, cover a cough or a sneeze. Disinfect and clean surfaces that are frequently touched, at least daily, and monitor your health so that if you have any symptoms of illness, you seek care quickly. A little bit about some science updates I'd like to turn to now. This last week, we had an interesting MMWR report about the prevalence of underlying chronic health conditions and how that sort of plays into the person's risk for severe illness and death. And we found that people who have some serious chronic underlying health conditions have a 6 times greater risk of being hospitalized and a 12 times greater risk of dying than someone without these conditions. And the conditions most commonly reported were cardiovascular disease, diabetes, and chronic lung disease. So this is helpful because it emphasizes what we've believed and known all along, which is these underlying medical conditions are things that people who have them should take into consideration and be especially careful at protecting themselves from becoming exposed and seeking care early if they feel sick. But this also doesn't mean that the rest of us don't have to protect ourselves. Everyone has to protect themselves, and by doing so, we help reduce the risk to persons who have these underlying conditions. Risk for infection and severe illness depends also on other factors, including, as we also learned last week, race, ethnicity, and other social and demographic factors. And I don't mean to say that we learned this for the first time last week. It's something we've known and been observing for some time. We had another publication looking at hospitalizations in Georgia that really re-emphasized this and put some data behind it. So part of the problem is due to the fact that Black workers are more likely than other workers to be in frontline industries or essential workers, which means that they're more likely to be out there encountering the opportunity to become infected with this virus. And although Blacks and African Americans represent only 13% of the US population, to date they comprise 22% of cases that have been reported to our agency. I also wanted to mention another report that came out just a few hours ago looking at the public's use of emergency departments. And unfortunately, but not unexpectedly, during the early part of the shutdown, attendance for either heart attacks or strokes went down by over 20%. And it's not because heart attacks and strokes went down. It's because people were less likely to seek the care for those conditions, we believe. As well, hospitals seeking for high blood sugar went down 10%. And we've known from other countries, we haven't got the data here yet, but I hope we will soon, that not only did the hospital attendance go down, but people were dying of these conditions outside the hospital. And I bring this to your attention because I want to make sure everyone understands that our hospital system is ready and able to receive us safely now to ensure that we don't get COVID, and that in the event we have it, they can take measures to protect themselves and protect the rest of the hospital staff and patients from transmitting the virus. So again, this is a good example that it's important to seek out care and we can take care of people safely now. Lastly, just a quick word about what's called Operation Warp Speed, or the effort to develop a vaccine. This is a federal effort that where the government is engaging with a select number of companies. The overall operation intends to deliver 300 million doses of a safe and effective vaccine against COVID by January of this next year, so about 6 to 7 months hence. As part of its broader strategy to accelerate the development, manufacturing, and distribution of not only vaccines, but also therapeutics and diagnostics. Our role, that is CDC's role in this, will be to lead efforts to distribute the vaccine and administer that distribution. And we'll also be supporting multiple lines of other efforts for vaccine development and implementation. And if you'd like to know more about this, Operation Warp Speed, or OWS. It's an unfortunate acronym, OWS, but OWS. Just go to hhs.gov and you can find it there. So I think I'll stop here. I look forward to taking your questions, and would now like to turn it over to Dr. Ussery to discuss CDC's latest guidance on how to stay safe in everyday life. Dr. Ussery?
Great, thank you, Dr. Brooks. Hi, everyone. My name is Dr. Emily Ussery, and I'm an epidemiologist on the community guidance team for CDC's COVID-19 response. And today I'm really pleased to be here to share some new guidance that CDC recently released on how to stay safe while going about daily activities like running errands or doing other personal or social activities. And I do want to let our audience know that the information I share on today's call will also be presented during a CDC Facebook Live event taking place this week on Wednesday, June 24th at 4 p.m. Eastern Time. So as communities and businesses are gradually opening, we know that many people are looking for ways to get back to some of their normal daily activities, and we want to provide you with some suggestions on how you can do that and stay as safe as possible. So as a reminder, individuals who have symptoms of COVID-19 or who have tested positive for COVID-19, or anyone who's recently been in close contact with someone who has COVID-19 should stay home and away from other people and avoid some of these daily activities until it's safe to be around others. So it's important to follow local and state guidance for quarantine and home isolation, and you can also find more information on CDC's website about this. We want to first start out by reminding everyone that this unprecedented pandemic has not ended, and every activity that involves interacting with others really has some degree of risk right now. So it's important to understand what those risks might be and also understand prevention measures that you can adopt to protect yourself and others to help reduce the spread of COVID-19. So in general, when thinking about activities, a good kind of rule is to think the more closely that you interact with others and the longer that interaction lasts, the higher the risk of COVID-19 spread. So before you go out, think about how many people will you interact with. Interacting with more people generally raises your risk, especially if you're doing activities with people who are outside of your household. And also interacting with people who aren't practicing social distancing or wearing cloth face coverings can also increase your risk. Another key point is to remember that some people who don't show any symptoms of COVID-19 could be infected and potentially able to spread the virus, which is why wearing of cloth face coverings by everyone is very important. The next thing to consider is, will you be able to keep 6 feet of space between yourself and others, and will you be indoors and outdoors? So the closer you are to other people, the greater your risk of getting sick. And outdoor spaces are generally less risky than indoor spaces because it's often easier to keep space in outdoor areas and there's more ventilation. And keeping distance is also very important, or especially important for those who are at higher risk of severe illness, which includes adults 65 years and older and people with severe underlying medical conditions. And then finally, what's the length of time that you'll be interacting with people? So spending more time with people who may be infected can increase your risk as well. As you decide whether or not you want to participate in activities outside of your home, there are a few questions that you can ask yourself to determine your own risk level. So first, is COVID-19 spreading in your community? And you can find this out by reviewing updates from your local health department to better understand your own local situation, and also to know what local orders and restrictions might be in place. If you do go out, think about, are you likely to come in close contact with people who are outside of your household? And also, are you at increased risk of severe illness, or do you live with someone who fits that higher risk criteria? If you do live with someone who's higher risk, then you and everyone in your household should also act as though you have an elevated risk level so that we can all do our part to protect everyone in our community. And then finally, do you take everyday preventive actions to protect yourself and others from COVID-19? So considering all of these factors, if you do decide to participate in activities out of the home, we really encourage everyone to continue to practice these preventive actions, which can include monitoring yourself for symptoms, washing your hands as often as possible, avoiding touching your face with unwashed hands, disinfecting surfaces, and of course, staying home if you're not feeling well. We also encourage people to practice social distancing by staying 6 feet apart from others who aren't in your household, and also to wear a cloth face covering, especially in situations where it may be difficult to practice social distancing and stay 6 feet away. As often as you can, choose outdoor activities in places where it's easier to stay 6 feet apart from people, like parks and other open air facilities. And also choose activities in places where there's limited sharing of items and where items are often cleaned and disinfected between uses. So CDC has developed a number of suggestions and practical tips for navigating some specific social situations or other errands. We don't have time to go through all of the scenarios that are provided on the website, but I did want to touch on a few examples, including going to the bank, dining out at a restaurant, hosting gatherings, and using gyms or fitness centers. And many of the general suggestions and the principles that you'll hear me mention in the context of these settings will also be applicable to other settings, but I do encourage you to visit CDC's website for the full list of tips. So when going to the bank, if you're going to do a routine transaction that doesn't require face-to-face assistance, we encourage people to use drive-through services or ATMs or mobile banking apps as much as possible to reduce the amount of face-to-face interactions that we're having. Also, you can call ahead and ask if the bank has any extra prevention practices put into place, like plexiglass barriers between customers and tellers, are staff wearing cloth face coverings, or do they have signs in the lobbies to remind customers to practice physical distancing? You can also use hand sanitizer, alcohol-based hand sanitizer after any deposit, withdrawal, or after using an ATM that requires touching of surfaces that others might have touched before you. And of course, remember to wash your hands thoroughly when you arrive back at your house. If you're deciding to dine out at a restaurant, again, before you go, you can check the restaurant's website and social media to see if they've implemented any COVID-19 prevention practices. Or you can call ahead and ask things like, our staff wearing cloth face coverings, and how are the tables set up? When possible, choose outdoor tables that are spaced at least 6 feet apart so you can maintain that social distancing that's so important right now. And if you are indoors and less than 6 feet apart from other people, it's especially important to wear cloth face coverings. And one final tip is, remember, don't share things like napkins or utensils with other people to avoid spreading the virus that way. If you decide to host a gathering with friends, like a cookout, there are a few tips for how you can do that in a safe way. So consider hosting your gathering outdoors if at all possible. If it's not possible, then make sure that the room or the space where you're having your event is well ventilated. So you can do things like open windows to bring in some outside air circulation. And when guests arrive, really encourage contactless greetings. You know, I know we all are really eager to give hugs and shake hands with people again, but really try to avoid those direct person-to-person interactions that bring you within 6 feet of other people, and instead use verbal greetings and waving to your friends. Also, consider providing single-serve options to avoid sharing between guests, and remind guests to wash their hands before and after eating. If you're planning activities too, think about activities that allow people to keep a safe distance from each other, like things like sidewalk chalk for kids or playing Frisbee golf. And then also consider keeping a list of the guests who attended your gathering, just in case there's a future need down the line for contact tracing. It will be helpful to have those names. If you're planning to start back at the gym, avoid sharing items that can't be cleaned or sanitized after use. And again, avoid person-to-person contact like high fives and elbow bumps and things like that. Also, look for facilities that are offering or that have outdoor space or offering options for virtual classes and training sessions as much as possible. And really limiting attendance at indoor group training sessions may be important, especially if social distancing isn't possible in the room. And sometimes in these situations, it might not be feasible to wear a cloth face covering. Wearing cloth face coverings are most important, though, when physical distancing is difficult. But we do realize that certain types of exercise or high-intensity activities might not make sense. So if you're doing these activities, you might consider doing them outside where you have more space to keep distance from other people. And then, if possible, wear a face covering when doing lower intensity exercises indoors, like walking on an indoor track, stretching, or yoga, for example. So these are just some of the tips on the website. And again, I would encourage you to go and look at this new section that's up under daily life. And we do recognize that some of the strategies that we've discussed and that we put out in this guidance may be difficult for some individuals or communities to implement. A range of individual and community level factors like people's job responsibilities or housing situations, neighborhood density, economic status are shaped by individual choices, but also societal forces such as institutionalized racism. And we know that these factors may in turn influence whether people are able to act on these suggestions. So it's really important for everyone to acknowledge that the ability to really practice these protective behaviors like self-quarantine, telework, and practicing hand hygiene may not be accessible to everyone in our community. So that's why it's so important for those who can perform these measures to do so as often as possible to really help protect others in their community. So in closing, we hope that this new guidance can really help individuals consider their own personal situation and potential risks before venturing out and resuming some of their normal daily activities. Of course, CDC is not able to determine the risk level for every activity, but we do know that risk depends on many factors, and there are also several things that you can do to stay safe while going out. The COVID-19 virus is thought to spread mainly from person to person and between people who are in close contact with one another. So activities are generally safer if you can maintain at least 6 feet of space between yourself and others. So this means that this summer, some of the activities that we choose may look a little different than last summer, but it may be safer to opt for things like hanging out with a small group in a friend's backyard versus attending a large concert or visiting a large crowded indoor event. So thank you so much for your time, and I'll now turn it back over to Dr. Tamika Smith.
Thank you so much. Thank you to Dr. Brooks and Dr. Ussery for sharing those updates. So the next part of the call belongs to our audience. It's the Q&A part. There were a number of questions submitted ahead of time, and so I'm going to just shoot them off both to you, Dr. Ussery, and you, Dr. Brooks. I'll flag for you which one belongs to who. And for the audience, you guys are quite welcome to submit additional questions in the Q&A box. So we look forward to that. Okay, we'll start with you first, Dr. Ussery. Let's go with, what behaviors should people practice to avoid catching COVID-19 at gatherings this summer? Are you on mute, Dr. Ussery? There you go.
Yep, can you hear me?
I can hear you.
I think I'm here now. Okay. Yeah, that's a good question. And I know people are anxious to gather with friends and family members this summer. But there are several important things that people can do when attending and also when organizing a gathering. So I think I've mentioned some of these, but of course, staying home if you're unwell, that's one way that we can really protect other people. Or even if you've had close contact with a person in the past 14 days, you should stay home and avoid gatherings. Another way, and sometimes I feel like I'm repeating myself, but these are really important principles, is by wearing a cloth face covering, especially when you're going to be somewhere at a gathering where you might be coming into close contact with other people. Of course, we always encourage people to maintain that social distance, but just keeping a cloth face covering with you anytime you leave and are going to a gathering can be a really important protective behavior. And of course, as Dr. Brooks mentioned, frequent hand washing is really an important tool as well.
Thank you so much, Dr. Ussery. And it is okay to repeat. Repetition, especially when it comes to those cloth face coverings, is super helpful. All right, let's see. Dr. Brooks, got a technical kind of a question here for you. Some retailers are implementing far UVC lights or considering the use of hydrogen peroxide for human and/or surface disinfection. Are these technologies actually effective at eliminating COVID-19? And are there health risks, from exposure to these technologies?
Well, thank you for that. Good question. It's one we get not infrequently, and it's important to talk about. First of all, I'll sort of answer the last part first. Using these, you have to be careful because they can be harmful. Ultraviolet lights, including those that are used for sterilization in the hospital setting, can cause sunburns, skin cancer, cataracts, just the way that sunlight can. So you need to be careful not to be overly exposed to those. And hydrogen peroxide can be harmful to tissues as well if it's too concentrated. There are products available commercially and that are endorsed by CDC and recommended by EPA for cleansing surfaces that are based on hydrogen peroxide. And you can do, if you are interested in that particular material, you can find information about it online. Also on our website, there's a link to all the different kinds of disinfectants that can be used for making sure that different types of surfaces are safe to be, what surfaces need to be cleaned, and that the materials that are, the disinfectants that are used are safe for those surfaces. The hydrogen peroxide's a interesting one, but the most common ones, and probably among the least expensive, would be just bleach as a disinfectant. Dilute bleach works just as well as many other things, and alcohol-based solutions, especially those, they need to be at least 60% alcohol containing. With regard to the UV light, we do use ultraviolet light in the healthcare setting to where it can be very effective at destroying bacteria and viruses when the intensity of the light is strong enough. But it's not routinely used in most consumer areas because of the risks I mentioned before. You know, we really want to make sure that people's eyes and skin are protected from exposure to this. And we don't have a recommendation at the present time that including putting ultraviolet systems into air handling systems, like you want to sterilize the air as it's moving through an HVAC system, is really going to do give you so much benefit that it merits the expense and the difficulty of doing that. I think, as Dr. Ussery had mentioned, that your best friend really in a situation like that is going to be ventilation and just keeping the air moving. This virus is transmitted almost exclusively in the context of close physical contact within 6 feet of someone, and it's possible that some of the particles that carry the virus that come out of our mouth are small enough that they can drift in the air, but they become diluted very quickly as they move. So getting that ventilation going can be a real big help.
Great, thank you, Dr. Brooks. Excuse me. Dr. Ussery, back to you. It is summertime, and like many people, I too am excited and really want to go travel. However, as we're thinking about traveling or reconnecting with friends and family, is it safe for me to travel somewhere or to go visit family? Is it okay in another state? Like, what does that look like for me?
Yeah, thanks for that question. I know this is on a lot of people's minds as summer starts, but again, you know, and as Dr. Brooks pointed out, kind of the situational awareness, we do have cases in all of our states right now, and the situation is really changing often. So staying close to home is generally the best way to protect yourself and others from getting sick. If you are thinking about traveling, there's a few ways that you can think about, or a few things that'll help you make that decision and kind of weigh the different risks. So first, think about, is COVID spreading where you're going? Because you can get infected, you know, while you're traveling and while you're in that area. Also, is the virus spreading in your community? Even if you don't know that you have it, if you don't have symptoms, you can still spread COVID to others while traveling. So that's a good way to think about also protecting the people in the community where you might be traveling. And then also, will you be in close proximity to others during the trip? Another important thing to consider is, are you traveling, are you or the other people that you might be traveling with more likely to get ill from COVID-19 and have severe illness? In that case, you might want to consider the risk of traveling in that context. If you are planning to travel overnight and stay at a hotel, we also have some tips about how you can stay safe during that trip. So just a few things are, before you go, again, you can call ahead to the hotel and see what kind of prevention practices they have in place to keep their staff and customers safe. Things like, are they using plexiglass barriers again at check-in counters, or physical distancing required in common areas? And then also you can ask about policies that the hotel has implemented about cleaning and disinfecting surfaces in the room, or if they're removing things like pens from the room that might be frequently touched by different people. And I guess one last tip is just to do as much contactless options as possible. So using online reservations and check-in, things like mobile keys, mobile payment, to just try to reduce your overall number of interactions with other people.
Great, thank you. I'm definitely going to take all of that into consideration and implement it. Thank you so much. Dr. Brooks, given some of the accuracy concerns around new tests on the market, what is the potential value of a diagnostic protocol, including multiple kinds of tests or repeated testing? For example, would it be helpful to administer an antibody test followed by a confirmatory PCR test?
Well, that's a great question. You know, probably the submitter is thinking about how we diagnose other diseases. It's a very typical strategy in some diseases to have a two-step testing protocol where you first use a very sensitive test to try and identify everyone who might have a condition, and then you would apply a test that's got more specificity to rule out those people who might have been falsely positive. So you want to use these two steps to find as many people as possible and then confirm that those that are the ones that are positive confirm the ones that are really positive. Right now, there isn't a recommended protocol for doing that with the available testing. I'd encourage folks who work in this area to consider looking at various strategies to see if a two-step protocol that includes a confirmatory step may be beneficial. There is a role for repeat testing, and that is in the case where you are concerned that the first result was not correct. And in that case, collecting a second specimen and running it again, it would be, will hopefully help reconcile that. It's extremely unlikely that two separate specimens would both be falsely positive or falsely negative in someone.
All right, thank you. Dr. Surry, back to you. Let me ask you a quick question about assessing risk. Could you provide an example of how CDC assesses risk of activities and which activities are safer than other activities? Is that a thing?
Sure. Yeah, that's a good question. So as I mentioned, CDC, we're not able to assess the risk level for every activity by every person, of course, but we do have some, I think our helpful tips can kind of put the spectrum of risk into perspective and think about different things you can do to reduce your risk when doing a specific activity. So as a general rule, the more people, I know I mentioned this, but the more people an individual interacts with and the longer this interaction lasts, the higher the potential risk of becoming infected. So if you can think about ways that you can have fewer interactions with fewer people and for a less amount of time, then that will help protect your risk. So we do have some examples in our guidance of, what would be considered a lower risk versus a higher risk activity. So for gatherings, as an example, lower risk would be, of course, holding virtual only activities that don't have interaction between people or direct face-to-face. So you're still able to have that social interaction, but avoid the physical interaction. And then thinking about higher risk might be a smaller outdoor and in-person gathering where individuals are still remaining spaced 6 feet apart and wearing cloth face coverings and not sharing and, still practicing a lot of those protective behaviors. And then the highest risk in that example might be a large in-person gatherings where it's very crowded and it's hard for people to remain spaced and people aren't wearing cloth face coverings. So that's a way to just consider the different levels of risk that might be involved in different situations and how you can protect against that.
Great. Thank you so much for that. I'm going to stick with you. I've got another question for you. If I use ride sharing, how do I reduce my risk from COVID-19?
Sure. So we do have some guidance on how to protect yourself when using transportation. So again, I would encourage the listeners to go to that page. It's under Daily Life and Coping. It's called Using Transportation. And so there's some general guidelines for using any types of transportation. So practicing hand hygiene, social distancing, the things that we've talked about today. For rideshare specifically, there's some additional steps that you can take. So think about avoiding touching surfaces that other passengers might have touched. Things like the door frame and handles, and making sure that you use a hand sanitizer or wash your hands if you do have to touch surfaces. And then avoid things like free water bottles or mints or other things that are offered. And if at all possible, remain as distant as you can. So try to sit in the back seat, away from the driver. Avoid pooled rides where other passengers might be picked up. And then also think about ways to improve ventilation in the car. So, you know, opening the windows or also bringing in some outdoor air through the ventilation system.
Thank you. And a wonderful answer, I must say so myself. All right. Dr. Brooks, back over to you. What tailored advice can you offer to people who had a disability in terms of staying safe during daily activities?
Right. So generally, we would recommend for folks with disabilities to do all of the same things we regularly recommend for people to stay safe. So the social distancing, washing your hands, washing your hands, washing your hands, wearing fabric face coverings, those sorts of things. But you know, people with disabilities, depending on the disability, may also have to take some other things into concern. For instance, if you require home care, someone to come to your house and turn you or help you in and out of bed or other parts of your activities of daily living, you want to make sure that that person is doing everything they can to likewise protect themselves from getting COVID-19, that they monitor their health closely, and they have a low threshold for finding someone else to come take care of you in the event they may have been exposed or think that they could have COVID. The people who have use a lot of complex equipment, either to transfer in and out of bed, or they have a chair they're using full time. You know, that is something you may want to consider sanitizing as part of your regular daily routine. And lastly, folks should know that some persons with disability may be at a little bit higher risk of COVID because they don't have the either because not a greater risk of acquiring it, but should they become infected, be at a little bit greater risk for having more severe disease because of respiratory problems. And folks in that situation should have a low threshold for seeking out care as quickly as possible.
Awesome. Thank you so much, Dr. Brooks. I know that's a very important subject. Okay, I've got another one for you, Dr. Brooks.
Okay.
And this is, again, thinking about summertime and the beach. Okay, so can you tell us about any specific guidance CDC has around being safe at the beach?
Safe at the beach. Yeah. It's funny. I was just the hour before this phone call was another call about how to go to the beach safely. So of course,
Perfect timing.
It's great timing, and I'm really looking forward to going to the beach this summer. I got to get out of my house. Woo, going nuts. So look, the beach is a great place. You know, it's full of fresh air, sunshine. You know, most days if you're lucky. You know, those are things that we know can decrease the risk of being exposed to COVID in a way that it could infect you. But a couple of things to bear in mind. First of all, to maintain social distance. And a beach is the kind of place, unlike other circumstances, let's say like a grocery store, where you can get up and move if you don't feel that that person who's plopped down next to you is far enough away. You can, you want to make sure that you, the foods that you bring with you, you've prepared them in a safe way so that you're the one in control of the food that you've prepared. If you do get food from an outlet, as Dr. Ussery was talking about with restaurants, you want to do a quick scan to make sure you feel comfortable with how they're preparing the food, that the servers are wearing fabric face cloths or some kind of a face covering, that the food appears to be getting prepared in a way that is safe insofar as that workers are wearing gloves and using good hand hygiene. There are a lot of other small details that come up around if you do get close to people, what you need to do. I would say just distancing is probably the biggest thing you can do. When swimming, salt water, this virus is it's a potent virus, but it's pretty darn fragile as well. And it doesn't like chlorine, and it doesn't do real well in high salt environments. So it's unlikely that, swimming in the ocean, you're going to get the virus from that water. So I wouldn't worry about that. And if you do need to, we also don't recommend wearing a face covering while you swim. Sorry, that was the last thing I wanted to make sure I recommended. Yeah, some people, I mean, really, you know, people do take things to extremes, and sometimes that you forget your own good common sense, but it's going to make it hard for you to breathe in the waves, and we don't want you inadvertently getting into trouble because you have a wet face cloth that's obstructing your capacity to breathe. Just stay away from folks, bounce around in the waves 6 feet apart if you can. Then when you come back, then when you dry off and put that back on if you're going to be close to people.
Very good. Very, very good. And I know people can take things to an extreme, so I'm glad that you mentioned that. You brought it back around to mention that, because sometimes they will definitely take you for your word. So
yeah, I haven't seen somebody with an N95 mask at the pool yet, which is reassuring to me.
Okay. Very good. Very good. I'm going to stick with you. I've got another question here. Is it safer for me to have gatherings with friends if they're the same group of friends over time? And what I mean by that is I've heard that a number of friends, or I've actually heard a lot of friends and family saying this, we're only going to get together with this group of people, our social bubble, to limit the number of people we're actually being exposed to.
Yeah, we all live in our own bubble, you know, and I love this idea of a social bubble is very appealing, and I think there's some good sense to it. You know, you're going to reduce, I think Dr. Ussery was mentioning, the fewer people you encounter, the lower your chances of being exposed to the virus and becoming infected. And especially if you are socializing with people who share your level, who share your concerns and level of risk, okay, then you're likely to, or more, they're as concerned as you are and more. That's going to help reduce your risk of transmitting infection among each other. Still, there are some things that we would recommend doing when you get together, even when they're your besties. And that would include things like no open chips and dips or popcorn or finger food. That's just probably would be good in general for preventing a foodborne outbreak. But when they're pretzels or you got taco, chips and things, people share a lot, and we would recommend not doing that now. You can pre-apportion. What we do at our house is we put out 3 or 4 bowls of chips that each couple, that's their bowl. And, and before you take more out of the bag, you're going to have to go sanitize real nicely, washing your hands or some alcohol, and then you may shake them out of the bag. Don't reach into the bag to take them out. Thank you very much. Also, if you're cooking on the grill, I know you want to be a great host. I know you want to serve your friends and family, but this is a great time to let them come and get their own hamburger or their own hot dog or their own steak, if you're that lucky, off the grill and serve themselves. And likewise, if you are going to have shared food at the table, either have people remove it with their own utensil or provide people with individual utensils that they can use so that you don't inadvertently pass something around by hand. And best of all, eat outdoors, stay outdoors. I mean, we have a lovely dining room. This time of year, I'd much rather be outside. It's not only probably nicer, in my personal opinion, but it's also safer. You're going to get that ventilation and the air moving that will reduce the likelihood that inside even if you break that 6-foot bubble, you're reducing your risk very substantially in a ventilated open area as compared to a closed, unventilated area.
Very good. All great points. I think that we can all kind of take and implement. So thank you for that. I have a question coming from the Q&A box that I think both you, Dr. Ussery, as well as you, Dr. Brooks, I want both of you to tag team on this one if you could. So earlier in the conversation, and I've mentioned this a number of times as well as both of my good experts on the phone, Dr. Ussery mentioned the terminology cloth face coverings. And there's a question here that they're wondering if that suggests that non-medical face masks that many people are wearing, does that mean that they're not recommended? I want to make sure that they understand on the other side of the line, the audience here, that what the accuracy of the statement was. So I'll have both Dr. Ussery as well as Dr. Brooks touch on that.
Sure, and so you're right to pick up on that our guidance really is asking the general public to wear cloth face coverings, and this is really intended to help keep people who may have the virus but are not necessarily showing symptoms or they don't know that they have it from transmitting it to others. So when we talk about cloth face coverings, it's important to remember that when I'm wearing one, I'm protecting you or other people around me, and when you're wearing one, you're protecting me. And things like surgical masks and N95 respirators are considered personal protective equipment and serve a different purpose. And these should really be reserved for our medical professionals and other first responders who rely on that to keep themselves safe. And so I may hand it over to Dr. Brooks to see if he has anything to add.
Yeah, thanks for saying that. I was going to add one more thing, which is that, if all things were equal and everything was widely available, I think, of course, we'd recommend, using the highest level of protection that's available. But two things I just want to say about cloth face coverings so that people know this. First, although we have not done the formal studies using SARS-CoV-2 to see if they protect against either exhaling it from your own breath or even protects you from inhaling it, which is, by the way, why masks were first invented, right? They were invented to protect our lungs from bacteria and viruses as well as dust particles that could be injure us. We know that although we haven't studied this with SARS-CoV-2, we have looked at the utility of cloth face coverings specifically for influenza, for some of the other viruses that cause human colds. And they are effective at reducing the amount of virus that is expelled by a person and can reduce the amount that's breathed in. We really focus, that's the first thing. We also focus on the fabric face covering in part because that probably is what people are going to most likely adopt and use. And I don't say that because I'm giving up all hope, but I can tell you, having trained as an infectious disease doctor and wearing these N95 masks for a very prolonged period of time, they're uncomfortable and they're difficult to breathe through. And my concern is that if you don't meet people halfway by giving them something that they would be able to adopt and tolerate, you're not going to get anywhere. So we want people to use these face coverings predominantly because they protect you from exhaling virus if you're infected and unaware of it. And because when you do it, hopefully that encourages other people to do it. If all of us adopt these face coverings, that each time one more of us adopt, let me put it this way, I'm going to put it a different way. Each time one more of us adopts this practice, it increases the protection for all of us. And I think that's a message that is so often lost, is that, it just feels remarkably selfish, if I can put it that way, to me sometimes, that people are like, well, I don't have to protect myself if these other people are protecting themselves. Well, that's partly true, but that's really not the best way in this difficult circumstance when we're all in the same boat together. We should all be working to do the same thing to protect each other. Let me think, was there anything else I wanted to mention about these? Oh, yeah. Also, this is a new business, these fabric face coverings. I don't mean that in an economic sense. I mean it like we haven't really used them much. And I really encourage folks I'm looking forward to some innovation in terms of the materials that we're able to use and how we're able to make these easier to use and more tolerable. I did want to add one last thing, which is you probably have seen these respirators. Those are the term we use for when you are using these surgical masks or the N95 respirator in a clinical or a industrial setting. You've probably seen the ones that have a little release valve in them, or you may have wondered, what's that funny nub on the mask? And that allows the air to be exhaled more easily with less resistance. We don't recommend using those for source control because that valve does not filter your air coming out of your mouth. So it will reduce your risk of inhaling something, but it's doing nothing to protect you from inadvertently infecting someone else by exhaling the virus. That's all.
Great. That's a great statement, Dr. Brooks. I had somebody ask me about that the other day, and now I have the official answer that I can provide back to them. So thank you for that. Okay.
Can I just add one thing, by the way?
Oh, sure. Yeah.
I want to say, I know this is going to be a little in the weeds, but I mean, we really want people to do this and this face cloth thing, and it's in all of our materials. It's one of our top line messages. And people sometimes have asked me, why don't you just require people to do it? And I need to remind people that, we're a scientific agency. We produce the best science, but we don't have regulatory authority the way that, let's say, FDA does, or the U.S. Department of Agriculture does. We would, if a jurisdiction decides that they want to, like the governor of California wants to, make it a requirement, we would support that insofar as that is likely to ensure that the most number of people are protected. But it's not possible for us to require something. But if somebody wants the science so that they can write a law that would allow them to require it, we'd be more than glad and very happy to provide them that evidence.
Great. Thank you. All right, we've got 4 minutes left, and I've got to close this down. Trying to see if I can get a quick question in before we go. That will be a shorter answer one. And I don't think we've got it. Okay. All right. So let me actually just conclude this time that we have together and say thank you guys so much for joining us. Thank you for providing all of your Q&A ahead of time, as well as the Q&A we were able to grab from the actual live Q&A box. We enjoy this time with you every week, so we do appreciate you joining us. Doctors Brooks or Ussery, do you guys have any closing remarks you can provide?
Well, I'd just like to thank you for having me today and letting me speak about these new considerations. Again, just encourage people to visit our website to read more of these and really spread the news by sharing them with your friends and family members and letting them know that you're practicing some of these behaviors and kind of share the message so that we can all work together as a community to keep everyone safe. So thanks so much.
Thank you, Dr. Ussery. Dr. Brooks, anything?
Yeah, I just want to echo exactly what Dr. Ussery said. I had trouble reaching my mute button. And reiterate that, we each have the opportunity through our own example to show people how to do this right. This, as I said at the beginning, is unfortunately not going to go away. And it is just waiting for people to slip a little, and we have to stay aware of it. Any behavior change is hard, and this one's especially hard, but I think with time it'll get easier. And so let's try and stick it through together, and we'll all come out at the end the better for it, I hope.
Yes, we are in this together. Thank you so much. Again, thank everyone for joining our call today. A recording will be posted online at CDC's COVID-19 webpage. The subscription link to receive future updates and invitations is listed on the screen, so please click away. Thank you again. Thank you. Please join us next week for another update. Talk to you all soon. Bye-bye.